Hi there, my name is Ashley. I'm going to be your nurse today. Did Dr. Smith come in earlier and speak to you about your test results? Perfect. So like he probably already mentioned, your blood test came back and they were showing signs of acute kidney injury. So I'm just kind of here to check in on you, see how you're doing, maybe answer questions that you have about what the doctor said. I know he probably wasn't in here for that long, but yeah, so I'm just here to check on you and see how you're doing. Yeah, of course, I can totally explain to you what acute kidney injury is. I know it can be confusing, and again, like I said, I assume he probably wasn't in here for too long. You probably didn't get all your questions answered, so I am totally okay and even more than happy to answer those questions for you. So acute kidney injury is nothing to be too worried about. You're fairly healthy and young, so there really isn't too much to be worried about with you. It's completely reversible if treated appropriately, which is great news. But the main thing we want to do with acute kidney injury is we want to identify the cause. There are quite a few causes, and the doctor is working on still figuring that out. I know he's ordered a few more tests to be done to make sure we can truly identify that cause so that we can get you the appropriate treatment. But once he does get that treatment going, you're going to start to feel a lot better, and those kidneys are going to be working just as they should be. But acute kidney injury, it's rapid, it's progressive, and it's basically just when there's a portion of time where your kidneys just aren't working as they should. So your blood tests were showing signs of that because you had increased BUN levels, creatinine levels. BUN is also known as blood urea nitrogen, which is elevated urea levels in your blood. Urea is something that's toxic and we want it to be excreted through our urine, but if your kidneys aren't functioning properly, then those levels are going to be elevated. Same with creatinine. Another one was your GFR levels were pretty low, so that is quite indicative of kidney function, and if they're low, then we know that your kidneys aren't functioning as properly and blood is not being filtered through your kidneys. If your kidneys aren't working appropriately, then you're also going to see elevated electrolyte levels, such as high potassium, high magnesium, high phosphate. You're going to see also elevated fluid. So you're going to have high fluid, which is also why you're having that elevated blood pressure and you're experiencing that high blood pressure. It's because your kidneys, again, are not able to filter out all that fluid from your body, and it's building up, as well as those electrolytes. So once we find out what's causing it, we're going to be able to treat it really, really soon. Some causes of acute kidney injury can be toxins such as alcohol consumption. Some antibiotics and some medications can be toxic to your kidneys. If there's something blocking blood flow to your kidneys and you're not getting enough blood to your kidneys and your kidneys aren't able to function properly. If there's an infection in your blood, same thing, your kidneys aren't getting that blood that they need to function properly. So again, like I said, the doctor is working on finding out the true cause of your acute kidney injury. But once he finds out the cause, then we're going to be able to treat that. Some forms of treatment that you might see, basically we want to treat those imbalances that you're having because your kidney is not being able to maintain balance within your body. So we want to manage those electrolyte levels. So you might be prescribed a diuretic, which is basically just going to help you pee out all that extra fluid, which is also going to help get rid of those electrolytes and balance out those high levels that we're seeing right now. You might be prescribed a blood pressure medication to lower that blood pressure from that excess fluid that you're having. As of right now, we're not noting any signs of infection, which is great. Your white blood cells were completely in the normal range, so no signs of infection, so no need to prescribe you an antibiotic. But yeah, just really here to monitor you and make sure you're doing okay. You seem to be doing great. Again, like I said, you're nice and healthy, and acute kidney injury is nothing to be too worried about. It's going to be completely reversible, and you should be discharged within a couple of days, if not sooner. once the doctor finds out that true cause and he can treat you. So yeah, that's just a basic gist of acute kidney injury. I could go on and on about it, but I'm sure that answers majority of your questions. Do you have any more questions about it? Great. So I'll be back to check on you and see what the doctor ordered. I know he ordered a couple tests to just see what's happening within your body. But once he starts ordering that medication, again, I'll be back to you to give you those, and I'll be back to check on you. If you have any more questions about anything, or if you need anything, I'll leave your call light right next to your bed, and go ahead and just press that button, and I'll be back to check on you and see how you're doing. Great. Thank you so much. Bye.